Medical knowledge never stays still. In 1950, medical knowledge used to double every 50 years. In 2010, it doubled in 3.5 years, and in 2020, it doubled in 73 days. And then came COVID. In COVID, we saw rapid cycles of testing, treatment protocols, vaccination, public health, and all of these frontline workers have to learn and adapt very fast. Knowledge is going to increase only at a much faster pace. Our challenge is how do you get this knowledge into the heads and healing hands of very, very busy healthcare workers who can use this to save lives? Traditional learning definitely has limits. The time it takes to train instructors, organize classroom, test knowledge, all of the overheads can be used by nurses, doctors, paramedics to actually treat patients and save lives. In normal e-learning also needs to adapt. It should not treat all learners at the same level. It is an inefficient use of time. It's an opportunity cost we can't afford. Properly designed adult learning platforms for healthcare have to be adaptive and intuitive. They need to adapt to the individual learner's level of proficiency. And in healthcare, when it comes to testing hands-on skills like resuscitation, the simulation should be realistic. It should provide real-time feedback to the learner. The platforms we've provided MedLern have been shown to be more effective, more consistent, and more scalable. We are now in more than 250 hospitals in the country with over 60,000 professionals in the ecosystem. We've completed more than 1 million hours of training, more than 4 lakh courses. This type of learning has also promoted motivation, engagement, and a very high knowledge retention and high confidence in the skills of the healthcare workers that we've trained. We have more engaged hospital staff, much higher quality of patient experience. In India, time is not on our side if we want to be prepared for the next challenge in healthcare. We need 3 times as many healthcare workers as we have today. And we need them to be continuously learning and refreshing and growing new skills. We need 70 to 80 lakh people trained in resuscitation training alone every year to improve the survival from sudden heart attack, whether it's inside or outside hospitals. Today, the training capacity for high quality resuscitation training is only 1 lakh a year. We need a long way to scale. The need of the hour are adaptive, instructorless, and innovative solutions that can scale and really prepare us to meet the next challenge.